I'm a lady. Don't tell Mr. Jennifer. There are some people who are telling Mr. Martha like that. So you can ask if you have a doubt, you can definitely ask. Many people, not one or two, many people. Because I'm a man, so they say Mr. Even if I don't tell Mr. Jennifer, there are some people who are telling, yeah. Yes, there you go. Once you are ready, you can start.
Good morning. I'm one of the receptionists here today. You're welcome. How may I address you, please?
You can call me Jennifer.
Okay, you can have your seat. Then, how is she to you?
Yes, nurse.
Okay. How are you feeling today?
I am worried about my father. You know, Mr. Lincoln. He's
Yeah.
81 years old and he has recently been diagnosed as suffering from kidney failure. And he is to undergo a tri-weekly dialysis program.
Okay. Miss Jennifer, I can understand your concern now about your father. Can you tell me little things about what you know about dialysis before now?
Yes. Yeah, nurse, I do not know anything about dialysis, and this concerns my father's health. So, I want to ask you, what is this dialysis? I would like to know some detailed information about my father's condition. What does kidney failure really mean?
Okay, thank you for your inquiries. Kidney failure is when the kidney stop functioning, and dialysis is the procedure that we do to remove waste from the body, to remove the fluid, either through bloodstream to filter it, or is a procedure that we do with through a machine that we use artificial kidney, or we can also call it filter, to filter the excess weight from the system. Do you understand that now?
Yeah, of course, nurse. I really
Okay.
understand.
And it is a use of meshing whereby it cleans the bloodstreams and remove the excess fluid from it. And this is normally it occurs to anybody above age 60 or less than 65 years, but it is more common with people with 60 years of age. And presently your daddy is likely to benefit more on dialysis since the
Yeah,
okay.
I understand. I would like to know more about what is involved in dialysis. What is it exactly?
Dialysis is a procedure used by a machine to remove excess waste from the blood, to clean the blood, and it will help the kidney to function well. It's like using artificial kidney to function when the normal kidney stop functioning.
Yes, of course. Why does my father have to come 3 times a week?
Okay. Thank you for asking that question. I'm going to explain to you in the little way. The schedule as based on the investigation carried out for your father, particularly concerning the level of his kidney functioning and the excess waste in the blood presently. And the more it do that, undergo the dialysis, the frequency can be reduced when the condition gets better. And if it takes lesser fluid this period, it's improving health status currently. um a series of management and plan will be given to him that he will need to adhere to. And these little changes can make a positive improvement concerning his health if you comply with the laid down rules.
Yeah, of course. And I want to know if dialysis will improve my father's current medical condition.
Okay. The procedure it is to improve the health, and it's unlikely. It depends on the how serious the kidney has been injured. But whichever way, presently going through dialysis will bring some comfort, relief of pain to him. And the moment the excess waste is out, he will feel much better. And the signs that can comes after or during dialysis can be fatigue, low blood pressure, or muscle cramp, which will be well managed during the process.
Yeah, that's fine. And are there any side effects or ongoing problems?
Is there any word? Can you repeat your statement?
All right. And one last thing, will the dialysis treatment be painful?
I want to explain to you that dialysis treatment is not that painful, but there's no procedure that would not have its or experience. But when it comes to pain, the pain management team is available to take care of everything that happens. And they are experts in those aspects where your daddy will feel little or no pain throughout the procedure. So be rest assured that your father is in competent hands and he will be well taken care of. And in case you notice anything, you should explain to us. We are here to assist and to provide support. So we'll be willing to render any support or assistance to him as quick as possible.
Yeah, thank you very much, nurse. I really appreciate
Thank you
your
for your concern.
concern.
Thank you for your
And
support.
I want to ask you one last question. I
Okay.
feel worried. For example, my father, he's 81 years old. And
Yeah.
then what could happen if he were to decide not to continue with this dialysis treatment?
Okay. Currently, with the condition, if a patient's kidney stops working, there are signs that will see the patient will not feel too comfortable with it, and the level of pain will increase. So if he stopped not to do it, I'm not in the best position to explain what to do concerning that currently. He will have to wait and complain to the doctor to let the doctor give a details of what to do. But based on the past investigation, this is what the doctors come plan for him to have a dialysis done. And if he wants otherwise, he will have to wait and explain to the doctor for a better clarification on that. I am a nurse, I'm not in best position to explain this to you. Is that all right?
Yeah, that's excellent.
Thank
I
you.
agree with you. Thank you very much. You have given me a lot of insights.
Thank you for your time.
Yeah, thank you once again. Yeah, now let me give you the feedback. So next, be ready, Kiran Kaur, and then Sholay. So Kiran Kaur, next. After that, Sholay. So the next candidate is Kiran Kaur, then Sholay Dubey, doctor. Right. Yeah. Toyin.
Yes,
Yeah,
sir.
there's a little bit improvement. There is level of confidence increased, but the fluency, yeah, it's a slow but steady. It's not fast. It's not very slow. It's average. It's going on well, but there is some sort of hesitation here and there,
Yeah.
and some sort of confusion. Yeah, of course, it exists, but you can work a little harder, and on a regular basis, you can be there. And then next one is quality sentences you can try. See, for example, last time you have used one quality sentence, immediately I told you this is a very excellent sentence. Like that, I did not find any such quality sentence here. So you can see, you could have said, hope for the best.
Okay.
Hope for the best, you can definitely say. That is how it goes. Then next one is, um, yes, the condition is extremely serious. Refraining from taking dialysis, participating in dialysis program would result in serious consequences.
Yeah.
Very serious consequences. Because because the unwanted materials produced in the body should be eliminated. The blood should be purified. Otherwise, these impurities will be lodged in the blood and in the body and develop toxins. This may lead to deterioration of health condition and even end in death. We don't want to speak, but if necessary, if they're adamant, we have to tell them. It's not making them afraid. God forbid. But this is the fact. So try to use quality sentences. I appreciate your concerns as a daughter. You're worried about the deteriorating health standards of your father. But the matter of fact is, the condition is very serious, and a non-compliance with the recommendations of the doctor will result in grave danger, including death. In the best interest of your father, the doctor, after considering every possible option, after great research and study, he has recommended tri-weekly dialysis. And there is no alternative to this. It's a must do option. It's not an option, it's mandatory. Hope you'll make your father understand. So explain him in clear terms. And if he is not interested also, try to convince him, assure him, and make him consent to this program. So try to think and create a thread of points, one after another, and build a plot. This is called plot construction method in an orderly or sequential pattern. This is how you can do. So that's it. So yes, those who are watching on the YouTube and in the Zoom, there are guests and other members. So if you're interested for such sessions, yeah, we have a batch coming up next week, Monday. So if you're interested, you can contact us. We have increased the capacity. So the doctors to 7 and the nurses to 10. So you can join the regular batches only if you're serious. Yeah, next, Kiran.